Doctor, good afternoon. Good afternoon. It's so good to be back in studio today. And we
Good
are
day and
excited.
welcome once again to you in out there listening to us. You are watching. Go on, Doc.
Oh, I thought you couldn't hear me. Good day, good day. We are excited to welcome on the program today Dr. Lashanta Smith, an accomplished trichologist and wellness practitioner at the Treatment Room Trichology and Wellness Center. Dr. Smith specializes in understanding how your physical health and hormonal levels influence your relationships and well being. We will be talking today about understanding your mate on a hormonal level. And our guest will present a biological perspective on how hormones shape your sex drive, emotions, and interactions with your mate. Whether you're looking to strengthen your bond or simply gain a new perspective on relationships, Dr. Smith expertise bring a unique blend of science and wellness to help us connect more deeply with our partners. So please let us welcome our guest today, Dr. Lashanta Smith. And I am Dr. Marie McDonald, and my host is Dr. Alvin Eburn, and he's going to introduce himself.
Well, I don't know what to say if they don't know us by now, Doc, because we do
Yes,
this
indeed.
every week, and I think we have a large group of people that follow us. But to those of you out there, welcome once again to the Relationship and Marriage Hour with Dr. McDonald and myself, Dr. Alvin Hepburn, right here in Nassau, Bahamas. Every week we bring you provocative, insightful, and informative um, information that will help you in your relationship and with your marriage. For those who are thinking about getting married, to those who are married, for those who are thinking of divorce, we talk about everything from Genesis to Revelation, from beginning to the end. And we are excited once again to be joined by Dr. Smith, who is here going to share some nuggets, some insight that will help us on this journey um, to wholeness, to wellness. Welcome again, Dr. Smith.
Thank you so much. I am delighted and honored to be on your show today. So I thank you so much, Dr. Hebron, and also Dr. McDonald. Now we are going to have some fun today, so I hope our listeners are ready. But when it comes to relationships and marriage counseling, the areas that we are generally here that people would talk about will be the physical, financial, emotional, and spiritual aspect of a relationship. Now, all of those areas are indeed important, but although they can present imperative concerns that need to be addressed, I think that oftentimes there is a huge missing factor. And this can serve as the last essential or perhaps crucial missing piece of the puzzle. And that's the biological perspective of a relationship. So that brings me to my topic, understanding your mate on a hormonal level. And I like to call it the hormone connection. And so when we look at men and women in a relationship or even in a marriage, a lot of times people get married and not so long after the wedding, all of the excitement and the partying and the thrill, they are disappointed. And it's because sometimes their perspective of what marriage should be like is far different when they really get into it, for both parties, the man and the woman. But I believe that this is because oftentimes we look for ourselves in our mate. Men will look for themselves in their wives, and wives will look for themselves in their husbands. And so we expect them to be us. And we're disappointed when they're not. And they're not supposed to. because men and women are vastly different. And the reason why we are is because of our hormones. Now, when it comes to hormones, men and women have the same hormones. We all have the same hormones. But what makes us different will be the level of hormones that we have. We first need to understand that. And the problem is, we as beings, we don't really understand that because nobody have never taught us this way. Our doctors are not teaching us this. Our churches are definitely not teaching us this. And even our therapists are not teaching us this. And so what we need to understand is that because of the different levels of hormones that we have, it makes us totally different. I love looking at hormones because it's so dictative. It tells us who we are. And it has receptors on the way that we think, the way that we feel, the way that we act, like almost everything. It controls almost everything. So the main hormone for men would be testosterone, and most people know that already, right? But as women, we have testosterone as well, but we have it in smaller numbers. It's like in the 2 digits if you look at it on the lab. Now, as for men, they have way more hormones, being testosterone, and that's in 3 digits, or at least it's supposed to be there. And for women, the main hormones would be estrogen and progesterone. Now, men have both estrogen and progesterone as well, but they have it in smaller amounts. So our dominant hormone as women are progesterone and estrogen, and for men is actually testosterone. So the first thing we need to do is understand what are hormones. Hormones are chemical messengers that the body uses to tell us how to feel, how to think, how to act. Like hormones controls everything. It's going to tell you when to have a sexual desire and when not to. It's going to tell you when to feel hungry and when you're full. It tells your hair when to grow and to fall out. So everything is basically controlled by hormones. It affects our mental, emotional, physical, and also sexual characteristics. And men and women have the same hormones, but the level would make us different. At this clinic, we test hormones all the time because we understand that in order for us to remain healthy and even have healthy relationships, we need to know where the levels are. So for men, testosterone being their main hormone, it makes them very, very sexual. It gives them a strong desire. So meaning that a guy is supposed to have a sex drive every single day. In the clinic, we actually call that a healthy boy. Now, some women or wives would say, my husband wants it all the time. Something is wrong with him. Nothing is wrong with him. That's what we call a healthy boy. That's how it's
Say that again. Say that again, Doc.
That is a healthy boy. That's what normal looks like for a man. Now, when it comes to females, especially younger cyclic females, we're not supposed to have that strong sex drive every single day. All right. There are times in the month that we will have stronger desires, and that's what normal looks like. But if a young female,
so Doc, let me stop you right there because we want our audience to get a part of this. So when we find relationships have problem, then it means because one is on the high and one is on the low. How can we remedy that in relationships? Because if you just have every day and a woman is maybe, how do we bring a balance?
Okay. First of all, it's awareness, understanding how your partner is supposed to be. Women will have a problem because her husband wants it every day and she thinks that's a problem. That's not a problem for him. That's his normal. So once she understands that, it makes it just a little bit easier at first, right? And then a man needs to understand that it's difficult for your wife to keep up with you because she's not supposed to have the strong sex drive like you have. If she does, she's sick hormonally and she's going to wind up with cancer. Okay? So it's not
going to wind up with cancer?
She's going to wind up with cancer. Like hormones are so dictative that they can even cause cancer for both men and women, especially of the reproductive organs. So that's prostate cancer for men, and that's breast cancer, uterine cancer, and ovarian cancer for females. So a woman is not supposed to have that drive. I'm actually afraid if a young female says, and I'm talking about cyclic who's still having a period, if she says, oh, I can have sex every day, that's not your normal. Your hormones are sick, and it's going to cause cancer if you don't get them balanced before that time. But if our listeners stick to this program, they're going to hear at the end, I'm going to give tips based on your question, Dr. McDonald. I'm going to give tips how we can create a balance with this, because we are so different. So we need to come to the middle and compromise. And I'm going to teach them how we can now compromise, because women can actually be stimulated to have more of a desire, even during the time that she's not supposed to have one. So there's some things that we can do to break protocol when it comes to our hormones. And I'm going to teach men as they listen, I'm going to teach them how to get more lucky with their wives. Okay. So
say that. I'm sticking till the end, Doc.
You better not move.
Yeah, so we often say, because testosterone is such a strong sexual hormone and men are supposed to have that drive every day, we often say, if a guy, like ladies who are listening, if your husbands are not chasing you around the house every single day, either two things: either he is sick hormonally or he is chasing another woman. Testosterone makes it great. And I know it sounds hard, but it's true based on how a guy is supposed to be made up. So, with the exception, there's one exception though. With the exception is, if the exception of him being very career driven. So he's really, really focused on career, and he comes home and he's still thinking about the office or work or something, then that can kind of distract him a bit. But the minute his mind comes off of that, he's going to be ready, and he's supposed to. Now, another thing I want to say, that testosterone is not supposed to decline with age. It's not supposed to. So a lot of times, especially in the medical field, they would say that it's normal as a guy gets older, his testosterone is supposed to go down, meaning that his sex drive will go down, his libido, his desire goes down, and then he will suffer with erectile dysfunction. That is not true. It's not supposed to decline with age. It declines as men get sicker and sicker. So it's not the age, but it's just more and more abuse to the body, more and more sugar, more and more toxic fluids, more and more alcohol, whatever it is they're doing. So they're getting sicker, and that's why it's going down. So can they get back up? Yes. Just work on lifestyle and diet, and it comes back up. And I'm going to teach them too how to do that. Okay. And testosterone also makes him very laser focused. So that's the reason why, if a woman, so wives, listen to this. And when you understand this, you're going to stop fussing your husbands. Because if you tell him to throw out the trash in the mornings, now I know for women, we would say we're doing everything. We're cooking breakfast for the family. We're packing the bag for the kids. We're getting the kids dressed. We're getting ourselves dressed. And most times the husbands are just dealing with themselves, right? So the one thing you ask him to do is take out the trash. That's it. And when you get back home from work that day, the trash is still there. So we're all upset, like, he did not even do it. But don't blame him for that. And I'm not making excuses for men. I'm teaching you how they are because of their hormones. They didn't choose to be this way. This is how God made them. So because testosterone makes him laser focused, he does not have the ability to multitask like we do. He can think and do everything one time. Most men cannot do that. They focus on one thing at a time. So in the morning, if he's focused on getting to work and making that money, that's the only thing he sees and hears. And when you say, I told you to empty the trash, he's going to be like, when did you say that? And he really did not hear because he's so focused. And so give him some slack with that. That's testosterone. Testosterone also gives him strength and muscles. That's why men are supposed to have more muscle and strength than women. And again, that makes him protective as well, too. Testosterone makes him more aggressive. So if we have females more aggressive than men, then we know that there's an imbalance, because men are supposed to be more aggressive in nature based on testosterone. It also makes him motivated and gives him a drive to go out there and support his family. So I believe that's another reason why God made men to be protectors and also providers. And testosterone is not a nurturing hormone. It's not. And that's why women do in most cases, women do far better jobs at taking care of children and raising children rather than men, because of the hormones. Now let's look at females, estrogen and progesterone being the main hormones. It makes us very nurturing. Estrogen is a very nurturing, caring, compassionate hormone. That's why by nature, women are more compassionate in most cases. Why do women tend to cry more than men? Estrogen. Estrogen can make us more sensitive as well, but it can all make us more emotionally unstable. Now, I know some people may disagree with me and maybe even come at me for that, but I'm a female and I'm saying that, especially for cyclic females. Estrogen changes all the time. It actually changes 4 times in a month for cyclic females. So she's going to be a different person every week in that month, and she's supposed to. She's going to feel different, she's going to think different, and she's going to act different. And so I usually like to say for men, when you're marrying that woman, when you say I do, you better be saying I do 4 different times, because you're saying I do to 4 different women in one. Because she's going to. So
4 different women in 1 month.
Yes. I don't like being this way, but this is how we are. And so let me give you an example. A husband can come home one day and he can say, honey, you're putting on a little bit of weight there. And she can just laugh and they can have fun over it. If he come home the next week and say the same thing, and that's the wrong week, oh, she's going to snap. She's not going to take it the same way. And then guys confused, like, I said it last week, it was funny. And this week, now she's crying and she's all upset. Like, I don't know. But that's who we are. And that's why we are emotionally unstable. And it also gives us the ability to multitask. So that means that women stress more than men. We stress more than men because we care more. We think about everything at the same time. We connect dots as well. That's why it's harder for women to sleep. Oftentimes, couples would come in and the wife would say, I'm dealing with insomnia. I can't sleep. But when I look over at my husband, before his head hits the pillow, he's asleep. And because men are laser focused, if he focuses on sleep, he's going to sleep. But when our head hit the pillow, we're still thinking about everything, the things that we were supposed to do the day before, and the things that we need to do the next day. And so that's why we're so good at connecting dots as well. Now, estrogen is not a sexual hormone. So this is the part where, although we have testosterone, we have small amounts, but estrogen is not really a sexual hormone. And it's certain times in the month that a woman is going to feel sexual. And the thing is, around the same time that an egg is released, she's ovulating, that's the time when she's going to have the highest sexual drive. So when you think about it, you think about creation and procreation, like who could have created us perfectly like that for mankind to continue? God. Because the same time she has that highest desire is the time when an egg is released. So oftentimes pregnancy is going to happen, right? But outside of that, it's up and down. Okay. And estrogen and, well, I should say sex hormones and stress hormones does not work together for women. It does not work at the same time. When one is up, the other one is down. So guys, you can have a stressful day at work and you come home and you still want sex. You can have a stressful day at work, you come home and you just want sex. For females, we are different. When we are stressed, that's the last thing on our mind. We don't even have a sexual desire at that time because all of our sex hormones are being stealed by cortisol. We all know that cortisol is the stress hormone. So it doesn't work the same time for women. So when one is up, the other one is down. So that's a hint. That's a hint right there to men. Don't stress your women and you'd become luckier. But as long as you stress her, you don't expect her to be sexual at the same time. Okay. So estrogen is also a very connecting hormone. When women feel disconnected, let's say she goes through a divorce or separation with her husband or a partner, it can affect her greatly, like more than it can affect a man, because estrogen needs to connect. It needs to feel connected to someone all the time. And that disconnection can create a lot of hormonal imbalances for her and can even lead to cancer. And that's why I often say when a woman goes through a separation or divorce, This is where her friends and her family members are supposed to now fit in, church members as well, fit in and connect to her, spend time with her, go out for lunch, go for dinner, take that place because she needs that bond. Estrogen is very, very connecting. The best time to have a conversation with your partners. Now, I know a lot of times in relationship and in marriages, the two would try to talk and oftentimes they're disagreeing. Arguments are always coming about and it feels like you're not getting your point out or across. There is a better time to have a conversation with a man. For men, morning time is not the time to have a conversation with him. I'm talking about a real important, maybe a heated conversation as well, a matter that you need to address. You don't want to do it in the morning because morning time, his testosterone is extremely high. That's when it's high in the mornings. Now, throughout the day, it kind of comes down a bit. So it tapers down. So that evening time when he returns home, that will be the better time. Now, remember I said testosterone makes him very aggressive. So he's going to defend himself. He's going to be a little more aggressive in the conversation. You may feel like you're not getting through to him. He's too aggressive at the time. His testosterone is all charged up. But if you wait until it comes down a bit, he's going to be a little bit more sensitive and compassionate and understanding. So that would be the better time to talk to him. Now, as for cyclic females, that's the young ones, the better time for a man to talk to her would be, well, first of all, it would not be the week that she's having a period. Her hormones are too low, and so therefore she's highly stressed. Her body is stressed because she's trying to make hormones, and she's not going to see it your way. But the week after the cycle, the period finish, then that's when will be the better time because estrogen is now high, and estrogen makes us like social beings. We just want to talk. We just feel so good when it's high, and that will be the better time. Now, as for menopausal women, once their hormones are balanced, you could basically talk to them anytime. Now, the problem is most menopausal females are out of balance. 99% of them. I can tell you that even based on testing and labs, their hormones are not normal. One way to know is menopausal symptoms. So menopause is not supposed to come with symptoms. So if a woman is getting hot flashes or mood swings or she's irritable, vaginal dryness, and low libido, she has no sex drive, and the list goes on and on. That's not normal. Menopause is supposed to come with absolutely no symptoms. Actually, when a woman gets in menopause, she's supposed to have a sex drive like a man, meaning that she's supposed to have a desire every day. That's the one time women get to have that drive every day and still be healthy. If she doesn't have that in menopause, then her hormones are imbalance and it needs to be fixed.
Oh, wow.
Right? Yes. Any questions there?
No, this is a wealth of information. There's just, you were clearing up so many things out there to our listening audience. Whereas, and two, you said something, and I just let me just drop this point there. And I'm so happy that you said it to open the eyes of my brothers all around the world, because I can come home one day and I'm like seeing my wife and she looks upset and I'm like, okay, what did I do now? What did I do? And then I'm like, honey, what's wrong? Because you know me as a man, my job is to fix the thing. So I want to find out what the problem is so I can go and fix it. Or fix him or her, whoever caused her to be the way she is. And then I get this snapping. Nothing is wrong. Why you think something is wrong? And I'm like, okay, I'm sorry. And then other weeks is heaven on earth. So now you are clearing up. So I am waiting to hear what is the magic pill that we all need to take to answer Dr. McDonald's question. How do we balance to bring them on the same level? Or does that ever happen? Does a man and a woman ever become on the same level with their especially with the sexual drive?
Okay, so naturally we won't until that female gets into menopause. But the
Yeah.
problem is, if a female is healthy going into menopause, her sex drive is going to be out the roof every day. But we don't see that in most older, mature females because by time as a woman gets into menopause, her hormones are just so sick. So sick. And most of that is caused by the stress that we encounter throughout our younger years. So by that time, the body can't make enough hormones. But
And then
if
too, Doc, on the flip
Mhm,
side of that, if a woman is healthy by the time she gets to menopause, because the man is so sick,
you got it.
it's like a twist. Now she wants it every day, and he's saying, "Woman, get from me."
Yes, you are so right. And that's what I was about to say. If that guy doesn't become healthy as he get older, now what's going to happen is his libido is going to go down. He's going to deal with erectile dysfunction because his testosterone are now too low, and she's in menopause and she's ready to go. Now we all know the movie Stella got her groove back, right? So that's how that movie came about. Stella had to find a younger guy because now their sex drive kind of matched. So that's a
Mm.
problem. So, man, we got to make sure that y'all are really becoming healthier as y'all get older so that this problem no longer exists in marriages and relationships. Okay. So, I always say a man is responsible for keeping his lady's hormones healthy, and a woman is responsible for keeping her husband's hormones healthy. And this is how we can do this. So I'm going to leave some tips. I'm just about done, but I'm going to leave some tips and how
Just,
both
just
parties
before you,
enhance.
just before you leave some tips, I have a question,
Okay.
Doc. In respect to a woman decreasing estrogen or hormone, however, we call it going through the changes. We call it going through the changes. And going through the changes, it is said that women go through all of these imbalance. Is that normal? Based on what I'm hearing, it's not normal. But why are we calling it going through the changes?
Okay. So it's common. And the problem is people are now confusing common with normal.
Oh
We even have
wow!
medical professionals are also doing that because they will tell you that is normal. And chances are they're probably going through it as well. Okay. But
Mm,
common is not normal. Even though we have 99% of the women experiencing it, it's still not normal and we should never confuse the two. Why is it that
mm,
when I have menopausal female patients come into my office and I can see them heating up and cooling down, heating up and cooling down, and they're like, I'm just miserable. When we start working together with them and helping them to become healthier, now they say, I no longer have hot flashes. And it doesn't even take
What?
long to stop. Now they say, I had no sex drive. Like it almost destroyed my marriage. My husband is a great husband, but I just didn't have the drive. And now they say, I now have that drive. It saved my marriage. If it's normal, we can never change that. No matter what we do, we cannot change that. But if it changes,
Where's
then
your clinic located?
but it's not normal. It's common, and people always confuse common for normal.
mm.
Really
That's
why it
interesting.
happens is because when we're cyclic females, our ovaries are making the majority of our hormones. When we become menopausal, our ovaries will take a back seat. And now our adrenal glands will have to take the forefront to these hormones. Now keep in mind the adrenal glands are also the stress glands. So it makes sex hormones and stress hormones, like I said. But if it's busy just making stress hormones, it's not going to prioritize making sex hormones. And now that estrogen that she needs, and yes, in menopause, there's a great decline in estrogen. So we don't need much during that time, but we still need a little bit. But I see women come in and they don't even have that. They don't have any estrogen. They don't have any progesterone. It's all gone. They don't have any of the androgen hormones that will give them the sex drive as well. Their hormones are tight. And so I'm like, this is an adrenal problem. You just been stressed for so long, taking care of the kids, taking care of the house, taking care of everyone, working two jobs. All of that is stress. As women, we're not designed for all of that. Men do far better with stress. Stress is the one thing that can destroy any female's health and cause cancer. It's worse than a bad diet. Now, for men, the worst thing for any guy's health is going to be sugar. Sugar just destroys them. And when we talked
Oh,
about that low level of testosterone, the first thing that will drain your testosterone is sugar.
Mm,
Yeah,
wow.
wow.
sugar. So I see it all the
What?
time. When men give up sugar, their lives change. Everything is fixed. When women stop
I have a
stressing, or at least,
question.
okay,
Is it all sugars or white sugar, brown sugar? Could we use agave, or do we have to just get away with what? What? Well, we all
it's
know sugar is a drug. So, gee,
yes, it is. But it's all sugars. It's even the sugar in fruits. That's fructose. That can destroy your testosterone. Some people consume too many fruits. Agave, that's one of the worst ones because it has the highest fructose in it. So it destroys the liver, and the liver is needed to actually convert your testosterone. Now, when you lose that testosterone, that has to go someplace. So where does it go? It goes down into estrogen. So sometimes I see men more estrogen dominant and they don't have any testosterone.
Mm,
What's up with that?
mm.
help
Let
us,
me
Okay, so
Lord,
pause.
that's
help us.
Let me pause right here and let our listeners know that they are listening to Love Bay Afrobeat Music Talk Radio, and we have as a special guest Dr. Lashanta Smith, and of course she is clearing up a lot of the problems that we see in marriages today and relationship. And I trust that our audience, if they're listening, if you have a question or a comment, please send them in. And we also wish for you to subscribe to Love Bay Afrobeat Music Talk Radio. And, we'd be happy to have you be a part of our show to talk, to give comments and questions. So thank you. And Dr. Lashanta, this is so good for us this evening. And, as you spoke a minute ago about women having four personality type, I'm calling it, it reminds me of Medea, Dr. Alvin. But
Yes.
can a woman be stable? Can she be stable at any time without those four characters popping up? Because I think now this is the reason why there are so many problems in marriages because of those four type,
yes. So,
help us
like I
to
said,
understand.
stress is the worst thing for females' health and hormones. And when she starts to reduce stress, eliminate stress, her hormones will be in a better position. And that's the time when she can be the happiest person. Because even when her hormones are supposed to be elevated and she's supposed to be feeling all good and sexual, if she's stressed during that time, it's going to be depleted. She's going to have less hormones. And have you ever seen a female who's just cranky all the time? She's not supposed to be that way. So that's telling me that there are a lot of stresses in her life that is just draining all of her hormones. You have no hormones, you basically have no life. No life. And then women sometimes they're estrogen dominant, like estrogen is high all the time. It's not supposed to be that way as well. That's going to lead to endometriosis, infertility, fibroids, hysterectomy, and even cancer. So we don't want to see endometriosis. But if those hormones are high all the time, then she may be a social butterfly all the. And again, still that's really not normal for us as females. It's a roller coaster. We're going to be up and down just like the hormones. But in menopause, women are more flat lying like men. They no longer have the cycles, the up and the down. So that's the time when I feel like a woman could be more emotionally and mentally stable is in menopause. But again, that's only if she's healthy in menopause. And that's not the reality for most females because they're not healthy in menopause. But these are some tips that can
Wow.
enhance and sustain a healthy relationship hormonally for both men and women. So let's start with the husbands. What can a husband do to support his wife and keep her hormones healthy? And bear in mind, men, as you keep her hormones healthy, you also keep the relationship healthy. And there are 5 things that he can do. The first one is help her and don't stress her out. So you can't expect her to come home from work. She has to cook. She has to clean. She has to help the kids with their homework. She has to prepare the clothes or whatever it is for the next day, prepare the meal for the next day, pack bags, do all of this, maybe a little bit of self-care as well. And then when she gets in the bed, you think something is supposed to happen. That's a lot of physical and mental, I would call it mental stress at the same time. So now she's stressed. How can she be sexual? And this is where the fight comes in, because he expects her to be sexual, especially if he is like a really good provider. He feels like he's obligated to this. And he has a hard time trying to understand, why isn't she giving this to me? But now with him understanding this, so imagine if that guy, by the time she comes home, let's say he got up earlier and he said, you don't have to cook dinner, I did it already. Oh my God, that sounds so good, right? Or the kids are all tucked in bed and the homework is completed and they're good. Oh my God, she feels good already. So when cortisol comes down, we know it goes up, right? So of course he's going to be rewarded by the end of the night. So help her and don't stress her. Make sure the stress is not coming from you. The second one is connect with her mentally. So the light switch for a woman is not in the man's cave. It's not there. So most men think that that's where it is. It's not there. It's outside of the man's cave, and it's actually in the brain. Women are stimulated in the brain. That's where the stimulation happens, mentally. And this can happen just based on a man talking to her. Connect with her. Remember I said estrogen is a very connecting hormone? Ask her, how was her day? How many times some men would just want to rush into sex and intercourse and think that she's a microwave like him? Men are microwave. Like, you can get an erection in seconds. But women, we are crock pots. We heat up a lot slower. And sometimes men don't want to put the work in. And if they do, she's more engaging as well. So the sex is more pleasurable, rather than if you're just ready to go because you're ready. She's not ready. You have to stimulate her mentally, but you don't have time for that. So now what's going to happen? You're the only one performing and she's just laying there. So take time to stimulate her mentally, because once serotonin and dopamine hormones are elevated, serotonin is the happy, feel-good hormone, and dopamine is the hormone that makes us laugh. That's laughter. When she can laugh, she's becoming stimulated towards you. When you can make her happy, she's becoming stimulated towards you. And so even that time of the month that she's not supposed to naturally be stimulated on her own or have that drive, a man can still work on the stimulation. And now this is how we can break the protocol with the hormones and get her now to have that same drive or desire that he now has. One food that contains the highest level of serotonin on the planet is, guess what? It's chocolate. It's chocolate. So how did chocolate get so popular around Valentine's time? Because men love buying chocolates, women love receiving chocolates. And when they eat chocolate, it stimulates serotonin, which is a happy, feel-good hormone. It lowers cortisol, and now she feels sexual. So as long as you can reduce stress for a woman, she can feel sexual. Chocolate is one of the foods that can do that. Okay. So guys, talk to her. Tell her she's beautiful. Make her laugh. Take her out on dates. Take her to her favorite place. Let her enjoy herself. You will get lucky by the end of the night. Learn and understand her menstrual cycle. If she's cyclic, if she's a younger female and still having a period, understand and learn her cycle as well. And the fourth one is tell her these 4 simple words. I choose you. I still choose you. 4 simple words. Because oftentimes we got married 10 years ago. And as women, like, we're always concerned about image. Sometimes we gain a little bit of weight. Sometimes our skin is not as firm as it used to be. We don't look the way we used to look 10, 20 years ago when you married us. And so now we can start to feel insecure about ourselves and compare ourselves to other women. And so now we want to hide our bodies and all of that, even from our husbands. But if you reassure her that you would choose her again and again and again, just like you did 10 years and 20 years ago, that alone is going to give us so much confidence, and she's going to be stimulated more and more towards you and feel comfortable with you as well. And then the last one, if you think your wife or your partner is not, her hormones are not the way that it should be, then make sure she gets her hormones properly tested. Now, for men, wives, what can you do to support your husband's hormones and to keep him healthy and also to keep the marriage and relationship healthy? The first one, and I know people are going to be like, what? The first one is don't feed him. What? Are we supposed to cook for our husbands, right? Yes, we're supposed to. But when I say don't feed him, I mean give him some moments to fast. Fasting is so good for men. Now, it's not always good for females. In some cases, we have to be very careful with it. But men, when they do, like, you can even start with intermittent fasting. But if you get into prolonged fasting, like a whole day, 24 hours of fast, 48 hours, or even 72 hours, it's going to kill him. It's going to make him healthier. But another thing it's going to do, after he's done fasting, his testosterone is going to be out the roof. Out the roof because he's not eating sugar. As a matter of fact, he's not eating. So his body gets time to make more testosterone. And I think that's why the Bible says after a guy fasts, the husband fasts, when you're done, go right back into your wife, because even God knows that your testosterone is going to be extremely elevated. And I guess he don't want you to be stimulated by the wrong person. So connect with your wife right away. So allow the man time to fast. And this is going to help him to reduce sugar intake as well. Also, the second one, show him. Show him. Do not allow him to see more skin in the streets than what he's seeing in the sheets. Men are visual.
Say that again, Doc. Say that again.
Do not allow him
on a t-shirt. That need to go on a t-shirt.
That's so true. Men these days are seeing far more on the streets than what they see in the sheets. Because we as females, we want to go to bed in so much clothes. We're like, oh, it's cold, so I have to put on all these clothes. You know, but no, he's going to be stimulated by what he sees. Mm-hmm. And what he sees, that's the brain as well. The only part of the brain that sits outside the head are the eyes. So that's the part of his brain. So when he sees something, especially when he looks at it long enough, that's why, guys, I would also say to you, protect your eyes. Keep your eyes only for your wives. Now, I know some men say, well, I'm not blind. No, you're not blind. But be careful staring too long in certain directions, because wherever you stare, you're going to be stimulated towards that. Because all you need once you stare is LH hormone. That's a hormone that is produced by the pituitary gland, luteinizing hormone is called. And when that mixes with cholesterol, that's all you need to stimulate testosterone. And now you're driven towards what you're looking at. Keep your eyes for your wives, but wives, give him something to look at. If you want him to look at you, you got to give him something to look at. He needs to see more skin in the sheets than what he's seeing in the street. So choose better clothes or outfits to go to bed in, and then it's the best way to actually keep him stimulated towards you. All right. The third one is, wives, don't speak down to your husbands. Don't. One of the quickest ways to destroy and lower testosterone is when we speak down to men. When we belittle them, yeah, they may be doing some things that we don't like sometimes, but speaking down to him is not making it any better. Actually, if you try speaking up, I think he stands a better chance at changing. But speaking down to a guy destroys his testosterone. It diminishes it. Because the thing is, as women, we're supposed to believe in our men. Even when we don't see the right things in them, we're supposed to still believe in them and support them. In the Bible, Sarah called Abraham her Lord. Her Lord. So we should not be talking to men like we're talking to one of our children. Because if we're talking down to them, We can't expect them to be sexually stimulated towards us. But if there's another woman out there, a co-worker or a friend or whoever it is, if she is speaking up to him, he is going to be sexually stimulated towards her. And you're going to lose him. So don't speak down to him. Speak up. The fourth one is schedule with him. Let him know when he leaves the house. Say, honey, when you get back home, tonight is going to be magical. And keep your promise. It doesn't matter what. Keep your promise. When you tell him that, he's going to be all jacked up all day. Testosterone is already going to shoot. And he can't wait to get back home to you. He's going to be the best behaved man because he knows what's going to be happening. So keep your promise at the same time. Don't let him down. And the last one is get his hormones properly tested if you think that he may be at an imbalance, because men are supposed to chase every single day. He's supposed to have that drive. Now, I'm not saying he's supposed to get it. He's supposed to have the understanding that his wife may not be able to engage every night because she's not him. She will never be him. And so once he understands that, but at the same time understand some things that he can do to help stimulate her, now this is where both parties can now compromise and come in the middle somewhere to reach a perfect balance. Right? So we need to understand that the divorce rate is extremely high, even among Christian marriages. And sadly, it may continue to go higher. We are busy talking about every other aspect of the relationship, but everyone is missing this one most crucial area, and it's biochemistry. We cannot have proper chemistry if you don't fully understand biochemistry. And who's teaching this to us? Nobody. Not your doctors, not your churches, not your therapists. But understanding your mate on a hormonal level and fully supporting that can significantly lead to a healthier, happier, and more loving, lasting relationship, because hormones are everything. And who designed us this way? God. God. So that brings me to the end. And I hope it was helpful for someone. I hope somebody takes it and applies it, because you always see the difference. You do this, you will see the difference in your marriage and in your relationship.
I'm almost lost for word, Doc, because this has opened my eyes to see that the reason we have so many issues in relationship is because of the lack of knowledge in the biochemistry. We don't know each other, we don't know our bodies. So when we have issues, we blame the one, your spouse, you blame your wife, and we all find a blame. Or he can this, or she can. But if we would stop long enough and learn our bodies and understand who we are, it will solve a lot of problem. Oh, and I like the line: more skin on the sheet than what's on the street. As
Yes.
women, married women, we need to, you know, learn these
Do
things.
better.
Do I don't know if you're gonna go do better. You do better when you do when you know better. But I want to help them to understand first and foremost themselves and learn about what is a man, what causes men to tick, what causes women, understand each other. And I love what she said. The responsibility of me is with him. The responsibility of her with him is with her. So if we both watch each other back, we would be able to help solve plenty of our
Yeah.
issues.
Yeah.
And guess
So
what? Another thing, his testosterone is higher in the morning. So if you get him on the wrong topic, no wonder there are so many arguments in the home first thing in the mornings.
Yes.
Because she would wait for him until he wake up. Now I'm going to get him. He been out all night. And then when she start, his testosterone, and he not only defensive, but he then began to argue. So there's always that morning quarrel.
Mm-hmm. Yep.
Dr. Alvin,
There
your
is.
thought.
like you said, Doc, this is This is an eye opener. This is Dr. Smith needs to go in every church, in every community. Every door needs to be open. And I'm serious with this, Dr. Smith, because many things that we are blaming, and let me get religious now. Many things we blame it on the devil, we blame it on the next door neighbor, we blame it on all kinds. It could just be the food we are eating.
Yes.
Wow.
Yes.
Too much sugar.
Yes.
Yes. And
Yes.
it could just be a
And
simple.
when sugar,
Go on, Doc.
sorry, go ahead.
No,
No,
you
I
go
was
on. You
about to
go.
say, okay, when a guy is busy just consuming so much sugar, that bread, that rice, that pasta, that potato, the sweet drinks that he's drinking, and then sugar itself, he's converting his testosterone into estrogen. And now estrogen wants to respond to everything. That's why women are more like snappy. They could row longer than men. Men more silent. They don't say much, right? But when his testosterone are looking like how his estrogen, well, his estrogen is looking like how his testosterone should be looking. Now, basically, you have two women in the home just rowing, can't get along.
Whoa.
So sugar is destroying our relationships. It's destroying our family. It's
And
destroying us.
and is this why too that he may begin to develop bigger breasts and all of that type stuff?
Yes, we call it man boobs. So sure
Yeah.
enough, that's estrogen. Estrogen is a growth hormone. It makes things grow like boobs.
Wow.
It can happen.
And that's
I had a
sugar.
guy who came in. His estrogen was so elevated that he was actually producing milk from his breast.
God.
What?
Estrogen and prolactin extremely high. His body was thinking he is a woman, and he was
So
not gay.
so
He's married, not gay.
so what do men do? Just stop sugar? Is it, or is there other
Sugar
stuff?
and there's other stuff as well, but sugar and inflammation. The first thing you got to do is block that pathway so he no longer depletes his testosterone into estrogen. While we work on why is he converting this way? Why is he over converting testosterone? So guys will go in the gym and they make all that testosterone because you make it by working out and exercising. He's all jacked up with testosterone. But because the diet is all wrong, and he think he can out exercise a bad diet, he's making all of that testosterone and now quickly converting that into estrogen because everything he eats is loaded with sugar, and he's also inflaming himself through his diet.
Wow.
This is powerful. This is powerful. Yeah. Wow. I
Yes.
don't know what to
So
say.
knowledge
I
is
don't,
power.
yes. This
Knowledge is
is
power, but what is more powerful is knowledge that is applied. Like people,
Yes.
they know it now, but now they have to do it. They have to apply it to their
Yes.
lives.
Yes. Yeah. For a
They can just
better
start
sex life, get rid of the sugar. Wow.
yeah.
For men.
and
Get rid
some
of the
men
sugar
love
for
sugar.
men. Get rid of the sugar for men and get rid of the stress for women, and we have better sex lives.
Yes.
Wow.
Those two S words. S
Yes.
and S.
Sugar and
Yeah,
stress.
get rid of them.
Stress.
Wow.
And give your wives more chocolate.
Yes, give them more chocolate. Make sure it's healthy chocolate too.
The black chocolate, not the regular chocolate, the black chocolate.
Yes, not
90%
processed chocolate.
chocolate.
Yeah.
That's the bitter one.
So let me share a quick testimony with you. This guy came in, his wife dragged him in. He was not happy about it, but he was sick. He was retired. He was older, but he was sick. He was on a ton of medications, diabetic heart disease, hypertension, you name it. And he was just sitting on the couch all day, just, I guess, watching sports and whatever, but no motivation, no drive, no energy, no strength, no libido, no sex. So when he came in for help, I tested his testosterone among some other things, and his testosterone was at 123. And I said, this is extremely low. It needs to be over 500. And he's like, well, I am 71. So meaning that he's older, should be low. I'm like, no, it's not supposed to decline with age, and I'm going to show you that. You do everything I say do for the next 3 months, and we're going to retest this. When we retested it, he was at 250, double the amount. Still not where he needed to be, but it was going up. Was he getting younger? No, he was 3 months older, but he was getting healthier. And that gave him momentum. He could feel energy already because testosterone gives a guy energy. So as you reduce inflammation and sugar, his energy is coming up. So now he's looking for things to do around the house to help out with. His sugar levels are looking better. His pressure's looking better. He's losing weight, everything. He likes it. We retested him. So he wanted to retest again in another few months. So we retested him again 9 months later. His testosterone was almost 900.
Wow.
No testosterone pill, no pellet, no nothing, no T clinics. Because a lot of T clinics are popping up now, especially in the US. And they have a wait list. Like to get on that list, you got to wait like 2 or 3 months in. That tells we have a lot of sick men. And that area, big area for them, their sex lives. So they're going to do it because they want to get it back, but it's not the right way because it can still make them sicker. You can get it back by just becoming healthier. And he was almost at 900. By this time, his wife said, I can't keep up with him. So she started now to do some healthy stuff because his libido was out the roof again. The erectile dysfunction that he dealt with previously, that was no longer his issue. He was off of most of his medications by that time. He lost weight. His energy is out the roof. He said, I feel better in my 70s than I did even in my 20s as a young boy. Now,
Wow.
we've seen some young guys in their 20s and their testosterone is in the 200s and 100. They're young and it's still low because the diet is just getting worse and worse and worse. People are getting sicker and sicker. And I said to him, I said, did I make you younger? He said, no, I actually got older because now I'm 72. I said, okay, so you got older, but your testosterone went up. If it's normal for it to decline with age, I can never get it higher no matter how healthy you became. It declines when men become sicker. If men, and it's so easy to take care of a guy. Like I always say, I'm going to turn the clinic into an all-male clinic because it's just so easy to fix them once they want to put the work in.
Yeah.
For women, our bodies are more complicated, so it takes us a little longer. We have to do more work. But guys, just get them off of sugar and their life changes. Changes. Give them 1 or
Wow.
2 supplements and it changes.
Okay,
Yes.
well,
Wow.
Doc, that is so powerful. Dr. McDonald, we may have to have Dr. Smith back because
Yeah,
we're not out of message, we just out of time. But
that's it.
wow,
Yes.
what an
That's it.
eye opener! What an eye opener! Um,
Yes, indeed.
well, I know plenty men now who who will want your information, so so that they can come and seek you out.
Well,
Oh wow,
wow.
Dr.
It's
McDonald.
amazing. Yes, it's amazing. And any last words? With 2 more minutes to go. Is there any last word you want to give to our listening audience before we leave, Dr. Smith?
Yes. Yes. I say your health, your hands. Like you have to take full responsibility for your health. I know we talked about hormones in relation to improving your relationship, but when you become healthier, your relationship will become healthy as well. The bottom line here is that we have to become more aware, more focused on our health, and we have to put the work in. You can't leave your health in the hands of nobody else but you. So when I have patients come in and they say, thank you so much, when they get lab reports that change or they feel better or they're off of meds, I'm like, it's not me. You did it. 90% of this journey was you because you have to put the work in. 10% was me. I didn't do much. Your health, your hands. And I hope that this helped to bring some awareness to a lot of people because by becoming healthier, we can help to prevent a lot of chronic diseases, especially like cancer, because it's on the rise and the numbers are scary. And when the hormones remain unbalanced for too long, cancer is the end result. It is.
Wow.
Wow. Thank you so much, Dr. Smith. And I hope you would be available to come back on because it really shows us that we are our own enemy in terms of some of our relationship, other than when there is other parties interfering with the relationship. we often are our own enemies. So we thank you for being with us, and we pray that you would be available to join us again. Dr. Alvin, any last words before we leave?
Just the T-shirt needs to come out. What was it, Doc? Let's leave with that one. More
More
skin. It
on the sheet than on
More
the
skin in the sheets
sheet.
than
oh,
in the streets. Yes,
Yes.
more
ah,
skin in the sheets
Powerful.
than what's being seen in the streets.
Thank you so
yes,
much, Doc.
Mhm.
Powerful. I
yes, it
You're
is.
enjoyed it.
welcome. You're welcome. It was my pleasure. I love to talk about hormones, one of my favorite topics. I love to test hormones. I like to see them on a report because when I see them, I can tell a person who they are, even if they don't tell me things about them.
Mm, awesome. Thank you. We're going to say
Pleasure.
bye to our listening audience. It was good being with you today. So
Yes.
we'll
Yes,
Until
say
next
bye.
sorry.
Until next
Yes.
time.
Likewise. Thank you so much for having me.